A 68-year-old patient with atrial fibrillation is being transitioned from IV heparin to oral warfarin. On day 3, the nurse notes INR 1.8 and APTT within therapeutic range. What is the priority nursing action? A. Discontinue heparin immediately. B. Continue both medications as prescribed. C. Hold warfarin until INR reaches 2.5. D. Administer vitamin K prophylactically. Answer. B. Continue both medications as prescribed. Rationale. Warfarin has a delayed onset. Overlap with heparin is required for at least 5 days, and until INR is therapeutic, 2 to 3 for 24 to 48 hours to prevent hypercoagulability. 2. A patient receiving continuous heparin infusion develops sudden hematuria and APTT of 120 seconds. What is the nurse's first action? A. Administer vitamin K. B. Stop the heparin infusion. C. Increase IV fluids. D. Recheck APTT in 1 hour. Answer. B. Stop the heparin infusion. Rationale. Severe bleeding with supertherapeutic APTT requires immediate cessation of heparin before antidote, protamine sulfate, is administered. 3. A patient on long-term warfarin therapy presents with black tarry stools and INR of 5.8. Which intervention is anticipated? A. Administer protamine sulfate. B. Administer vitamin K. C. Increase warfarin dose. D. Start heparin infusion. Answer B. Administer vitamin K. Rationale. Elevated INR with bleeding indicates warfarin toxicity. Vitamin K is the reversal agent. 4. A post-operative patient receiving subcutaneous heparin develops a platelet count drop from 250,000 to 90,000. What is the nurse's priority? Answer. B. Stop heparin and notify provider. Rationale. This suggests heparin-induced thrombocytopenia, HIT, a life-threatening complication requiring immediate discontinuation. 5. A patient taking warfarin reports starting a high-protein diet rich in leafy greens. What is the expected effect? A. Increased bleeding risk. B. No change in INR. C. Decreased warfarin effectiveness. D. Increased INR. Answer. C. Decreased warfarin effectiveness. Rationale. Vitamin K-rich foods antagonize warfarin, lowering INR and increasing clotting risk. A nurse is monitoring a patient on heparin infusion. Which lab value is most important? A. INR. B. Platelet count. C. APTT. D. Hemoglobin A1C. Answer. C. APTT. Rationale. APTT is the primary lab used to monitor heparin therapy effectiveness. 7. A patient on warfarin is prescribed trimethoprim sulfamethoxazole. What is the priority concern? A. Reduced anticoagulation. B. Increased bleeding risk. C. Hyperkalemia. D. Thrombocytopenia. Answer. B. Increased bleeding risk. Rationale. Many antibiotics potentiate warfarin, increasing INR and bleeding risk. A trauma patient requires immediate anticoagulation reversal while on heparin. Which medication is administered? A. Vitamin K. B. Protamine sulfate. C. Fresh frozen plasma. D. Aspirin. Answer B. Protamine sulfate. Rationale. Protamine sulfate neutralizes heparin rapidly. 9. A patient receiving warfarin has an INR of 2.5 with no signs of bleeding. What is the appropriate nursing action? A. Hold the medication. B. Administer vitamin K. C. Continue current dose. Answer. C. Continue current dose. Rationale. INR 2 to 3 is therapeutic for most indications. 10. 10. A nurse notes that a patient on heparin develops sudden chest pain and dyspnea. Platelets drop significantly. What complication is suspected? A. Pulmonary embolism from HIT. B. Warfarin toxicity. C. Myocardial infarction. D. Fluid overload. Answer: A. Pulmonary embolism from HIT. Rationale: HIT paradoxically increases clot formation despite low platelets, leading to thrombotic events. A 72-year-old patient on chronic warfarin therapy for deep vein thrombosis presents with spontaneous epistaxis and an INR of 6.2. The patient is hemodynamically stable. What is the most appropriate initial intervention? A. Administer protamine sulfate. B. Hold warfarin and administer low-dose vitamin K. C. Initiate heparin infusion. D. Transfuse packed red blood cells immediately. Answer: B. Hold warfarin and administer low-dose vitamin K. Rationale: INR greater than 6 with active bleeding requires holding warfarin and administering vitamin K. Stable patients do not require aggressive transfusion unless bleeding is severe. A patient on IV heparin for pulmonary embolism has a therapeutic APTT, but suddenly develops severe abdominal pain and hypotension. What is the nurse's priority suspicion? Answer: B. Internal hemorrhage. Rationale: heparin increases risk of occult internal bleeding. Abdominal pain with hypotension signals possible life-threatening hemorrhage. 13. A nurse is educating a patient starting warfarin therapy. Which statement indicates correct understanding? A. I will take aspirin daily to enhance effect. B. I should keep my vitamin K intake consistent. C. I can stop the drug once I feel better. D. I do not need routine blood tests. Answer: B. I should keep my vitamin K intake consistent. Rationale: consistency in vitamin K intake is critical to maintaining stable INR levels. 14. A patient receiving heparin therapy has an APTT of 35 seconds, subtherapeutic. What is the appropriate action? A. Decrease infusion rate. B. Maintain current rate. C. Increase infusion rate per protocol. D. Administer vitamin K. Answer: C. Increase infusion rate per protocol. Rationale: subtherapeutic APTT indicates insufficient anticoagulation, increasing clot risk. 15. A patient on warfarin is scheduled for emergency surgery. INR is 3.5. What is the priority intervention? A. Administer protamine sulfate. B. Delay surgery. C. Administer vitamin K. D. Increase warfarin dose. Answer: C. Administer vitamin K. Rationale: rapid reversal of warfarin effect is required before surgery to prevent excessive bleeding. 16. A patient on heparin develops oozing at IV sites and gums. APTT is mildly elevated. What is the nurse's best action? A. Continue infusion and monitor. B. Stop infusion immediately. C. Reduce infusion rate per protocol. Answer: B. Stop infusion immediately. Rationale: the primary responsibility of the nurse when a patient exhibits signs of active bleeding while on a high-alert medication is to ensure patient safety by stopping the source of anticoagulation. 17. A patient on warfarin therapy presents with severe headache and confusion. What is the nurse's priority action? Assess for dehydration. B. Administer analgesics. C. Suspect intracranial bleeding and notify provider. D. Check blood glucose. Answer: C. Suspect intracranial bleeding and notify provider. Rationale: neurological symptoms in anticoagulated patients indicate possible intracranial hemorrhage, a medical emergency. 18. A nurse notes a patient on heparin has a platelet count of 80,000 with no bleeding. What is the priority intervention? A. Continue therapy. B. Hold heparin and notify provider. C. Administer vitamin K. D. Increase fluid intake. Answer. B. Hold heparin and notify provider. Rationale. Platelet count less than 100,000 suggests HIT. Heparin must be stopped immediately even without bleeding. 19. A patient taking warfarin asks about over-the-counter medications. Which should the nurse advise to avoid? A. Acetaminophen. B. Ibuprofen. C. Multivitamins. D. Calcium supplements. Answer. B. Ibuprofen. Rationale. NSAIDs increase bleeding risk when combined with warfarin due to platelet inhibition. 20. A patient on heparin therapy is being transitioned to warfarin. When should heparin be discontinued? A. Immediately after first warfarin dose. B. When INR reaches therapeutic level for at least 24 hours. C. After 24 hours of overlap. D. When APTT normalizes. Answer. B. When INR reaches therapeutic level for at least 24 hours. Rationale. Overlap is required until warfarin reaches therapeutic effect to prevent clot formation. 21. A 64-year-old patient on warfarin therapy for a mechanical valve presents with bright red rectal bleeding and an INR of 4.9. The patient is alert and hemodynamically stable. What is the nurse's priority action? A. Continue warfarin and monitor. B. Hold warfarin and prepare to administer vitamin K. C. Administer protamine sulfate. D. Increase oral fluid intake. Answer. B. Hold warfarin and prepare to administer vitamin K. Rationale. Active bleeding with supratherapeutic INR requires holding warfarin and reversing with vitamin K to reduce bleeding risk. 22. A patient receiving continuous heparin infusion has an APTT of 95 seconds with no visible bleeding. What is the most appropriate nursing action? Answer. C. Decrease infusion per protocol. Rationale. Elevated APTT without bleeding is managed by reducing the heparin dose rather than stopping it entirely. 23. A patient on warfarin therapy reports new onset of severe flank pain and dark urine. What complication should the nurse suspect? A. Urinary tract infection. B. Kidney stones. C. Renal hemorrhage. D. Dehydration. Answer. C. Renal hemorrhage. Rationale. Anticoagulated patients presenting with flank pain and hematuria may be experiencing internal bleeding. 24. A nurse is assessing a patient on heparin therapy. Which finding requires immediate intervention? A. Mild bruising at injection site. B. APTT slightly above range. C. Sudden drop in blood pressure. D. Small nosebleed. Answer. C. Sudden drop in blood pressure. Rationale. Hypotension may indicate severe internal bleeding and requires immediate action. 25. A patient taking warfarin develops purple discoloration of the toes. What is the priority nursing action? Elevate the legs. B. Apply warm compresses. C. Notify provider immediately. D. Encourage ambulation. Answer. C. Notify provider immediately. Rationale. Purple toe syndrome is a rare complication of warfarin, indicating cholesterol embolization, and requires urgent evaluation. 26. A patient on heparin therapy is scheduled for lumbar puncture. What is the nurse's priority action? A. Continue heparin. B. Hold heparin before procedure. C. Administer vitamin K. D. Increase infusion rate. Answer. B. Hold heparin before procedure. Rationale. Heparin must be held to reduce risk of spinal bleeding during invasive procedures. 27. A patient newly started on warfarin asks why frequent INR monitoring is necessary. What is the best response? A. To monitor kidney function. B. To ensure your blood is not too thin or too thick. C. To check for infection. D. To evaluate liver enzymes only. Answer. B. To ensure your blood is not too thin or too thick. Rationale: INR monitoring ensures therapeutic anticoagulation while preventing bleeding or clotting. 28. A patient on heparin develops back pain and lower extremity weakness. What is the nurse's priority concern? A. Muscle strain. B. Spinal hematoma. C. Arthritis. D. Dehydration. Answer. B. Spinal hematoma. Rationale: heparin increases risk of spinal bleeding, especially with neurological symptoms. This is an emergency. 29. A patient on warfarin has an INR of 1.4. What is the priority interpretation? A. Therapeutic level. B. Increased bleeding risk. C. Subtherapeutic, risk for clotting. D. No clinical significance. Answer. C. Subtherapeutic, risk for clotting. Rationale: INR below therapeutic range indicates inadequate anticoagulation and increased thrombotic risk. 30. A nurse notes that a patient on heparin has developed large ecchymoses and a decreasing hemoglobin level. What is the first action? Document findings. B. Stop heparin infusion. C. Increase fluid intake. D. Apply pressure to bruises. Answer. B. Stop heparin infusion. Rationale: signs of active bleeding require immediate discontinuation of heparin before further intervention. 31. A 70-year-old patient on warfarin for chronic atrial fibrillation presents with sudden onset of severe lower back pain, hypotension, and a drop in hemoglobin. INR is 3.9. What is the nurse's priority action? A. Administer analgesics. B. Continue warfarin therapy. C. Suspect retroperitoneal bleeding and notify provider immediately. D. Encourage ambulation. Answer. C. Suspect retroperitoneal bleeding and notify provider immediately. Rationale: severe back pain with hypotension and anemia in an anticoagulated patient strongly suggests internal hemorrhage, a life-threatening emergency. 32. A patient receiving heparin infusion has an APTT of 28 seconds. What is the nurse's priority action? A. Decrease infusion rate. B. Maintain current rate. C. Increase infusion rate per protocol. D. Stop infusion. Answer. C. Increase infusion rate per protocol. Rationale: subtherapeutic APTT indicates insufficient anticoagulation and increased clot risk. 33. A patient on warfarin therapy reports taking herbal supplements, including ginkgo biloba. What is the nurse's priority concern? A. Decreased INR. B. Increased bleeding risk. C. Hypertension. D. Reduced drug absorption. Answer. B. Increased bleeding risk. Rationale: ginkgo biloba can potentiate anticoagulation effects, increasing bleeding risk. 34. A patient on heparin develops sudden severe headache, vomiting, and blurred vision. What is the priority nursing action? A. Administer antiemetics. B. Lower head of bed. C. Stop heparin and notify provider. D. Check blood glucose. Answer. C. Stop heparin and notify provider. Rationale: neurological symptoms suggest possible intracranial hemorrhage, requiring immediate discontinuation. 35. A patient on warfarin has an INR of 9.0, but no active bleeding. What is the expected intervention? A. Continue warfarin. B. Administer vitamin K. C. Start heparin. D. No intervention needed. Answer. B. Administer vitamin K. Rationale: Critically high INR, even without bleeding, requires reversal to prevent spontaneous hemorrhage. 36. A nurse is caring for a patient on heparin who suddenly develops cold, pale extremities with diminished pulses. Platelets are significantly decreased. What is the priority action? A. Apply warm compresses. B. Continue heparin. C. Stop heparin and notify provider. D. Elevate extremities. Answer: C. Stop heparin and notify provider. Rationale: this presentation suggests HIT with thrombosis, requiring immediate discontinuation. 37. A patient on warfarin therapy asks why bridging with heparin is required at initiation. What is the best response? A. Warfarin works immediately. B. Warfarin initially increases clotting risk before becoming therapeutic. C. Heparin prevents bleeding. D. It reduces side effects of warfarin. Answer: B. Warfarin initially increases clotting risk before becoming therapeutic. Rationale: warfarin reduces protein C first, creating a transient hypercoagulable state. 38. A patient receiving heparin has minor gum bleeding and an APTT within therapeutic range. What is the best nursing action? A. Stop infusion immediately. B. Continue therapy and monitor closely. C. Administer protamine sulfate. D. Increase infusion rate. Answer: B. Continue therapy and monitor closely. Rationale: minor bleeding with therapeutic levels does not require stopping therapy, but warrants close observation. 39. A patient on warfarin presents with sudden vision changes and slurred speech. What is the nurse's priority? A. Check INR later. B. Encourage rest. C. Suspect intracranial hemorrhage and activate emergency response. Answer: C. Suspect intracranial hemorrhage and activate emergency response. Rationale: neurological deficits in anticoagulated patients are medical emergencies due to risk of brain bleeding. 40. A nurse notes a patient on heparin has an unexplained drop in hemoglobin with stable APTT. What is the priority action? A. Continue therapy. B. Stop heparin and assess for hidden bleeding. C. Increase infusion rate. D. Document only. Answer: B. Stop heparin and assess for hidden bleeding. Rationale: falling hemoglobin may indicate occult bleeding even if APTT is therapeutic. 41. A 66-year-old patient on long-term warfarin therapy presents with spontaneous bruising, bleeding gums, and an INR of 7.5. The patient is stable, with no major hemorrhage. What is the nurse's priority intervention? A. Continue warfarin and monitor. B. Hold warfarin and administer vitamin K. C. Administer protamine sulfate. D. Start heparin infusion. Answer: B. Hold warfarin and administer vitamin K. Rationale: INR greater than 7 with bleeding signs requires reversal with vitamin K, even if bleeding is not yet life-threatening. 42. A patient on heparin infusion suddenly develops tachycardia, hypotension, and abdominal distension. What is the nurse's first action? A. Increase IV fluids. B. Stop heparin infusion. C. Reassess in 30 minutes. D. Administer vitamin K. Answer: B. Stop heparin infusion. Rationale: signs indicate possible internal hemorrhage. Immediate discontinuation is critical before further intervention. 43. A patient on warfarin therapy has an INR of 2.8 and reports no bleeding symptoms. What is the appropriate nursing action? A. Hold medication. B. Reduce dose. C. Continue current therapy. D. Administer vitamin K. Answer: C. Continue current therapy. Rationale: INR within therapeutic range, 2 to 3, indicates appropriate anticoagulation. A patient receiving heparin develops severe thrombocytopenia and new thrombosis. What is the priority nursing action? A. Increase heparin dose. B. Stop heparin immediately. C. Administer aspirin. D. Continue therapy. Answer. B. Stop heparin immediately. Rationale. Heparin-induced thrombocytopenia. It, with thrombosis, is life-threatening and requires immediate cessation. 45. A patient on warfarin is scheduled for dental extraction. What instruction should the nurse prioritize? A. Double the dose before procedure. B. Stop warfarin abruptly without provider input. C. Consult provider for possible temporary discontinuation. D. Take aspirin before procedure. Answer. Consult provider for possible temporary discontinuation. Rationale. Procedures may require holding warfarin to reduce bleeding risk. Must be provider directed. A patient on heparin therapy develops sudden flank pain and a drop in blood pressure. What complication should the nurse suspect? A. Kidney infection. B. Internal bleeding. C. Dehydration. D. Electrolyte imbalance. Answer. B. Internal bleeding. Rationale. Heparin increases risk of internal hemorrhage, especially with hypotension and pain. 47. A patient taking warfarin reports drinking large amounts of cranberry juice daily. What is the priority concern? A. Decreased INR. B. Increased bleeding risk. C. Dehydration. D. Hypertension. Answer. B. Increased bleeding risk. Rationale. Cranberry juice can potentiate warfarin, increasing INR and bleeding risk. 48. A nurse notes that a patient on heparin has developed persistent oozing from surgical sites and an APTT significantly above therapeutic range. What is the priority intervention? A. Continue infusion. B. Decrease infusion rate. C. Stop heparin and prepare protamine sulfate. D. Administer vitamin K. Answer. C. Stop heparin and prepare protamine sulfate. Rationale. Active bleeding with supratherapeutic APTT requires stopping heparin and reversing with protamine sulfate. 49. A patient on warfarin therapy presents with sudden severe abdominal pain, hypotension, and signs of shock. What is the nurse's priority action? A. Administer analgesics. B. Continue monitoring. C. Activate emergency response and prepare for reversal. D. Encourage oral fluids. Answer. C. Activate emergency response and prepare for reversal. Rationale. Signs indicate life-threatening internal bleeding requiring immediate intervention and reversal. 50. A nurse is caring for a patient transitioning from heparin to warfarin. Which finding indicates safe discontinuation of heparin? A. APTT is normal. B. INR is below 2. C. INR is therapeutic for at least 24 hours. D. Platelet count is normal. Answer. C. INR is therapeutic for at least 24 hours. Rationale. Heparin should be discontinued only after warfarin has reached a stable therapeutic INR to prevent clot formation.
You just went through some of the most dangerous and most tested differences between warfarin and heparin. These aren't just exam traps. They're real life or death clinical decisions. If you noticed, Nclex doesn't test memorization. It tests whether you can recognize bleeding early, prioritize safety, and act before it's too late. So before you move on, ask yourself, can you quickly identify which drug requires PT/INR versus APTT? Do you know which antidote to give without hesitation? Can you spot subtle signs of internal bleeding before it becomes obvious? Because on exam day, hesitation equals mistakes. Keep training your clinical thinking. Stay sharp. And remember, safe nurses don't guess. They recognize patterns.